Welcome to Getting Mental with Dr. Dean. Please remember to like, subscribe, and share these videos. This is episode 7, part 1 of suicide prevention and awareness. Please remember that this is for information and educational purposes only. This does not constitute a client counselor relationship of any kind. This is not health or mental health advice. If you find yourself in a mental health crisis, please call 988-911 or go to your nearest emergency room. So September is the National Suicide Prevention Month. So if you take anything away from this video, please remember to be nice and caring, show others that you care, and just treat others with respect. If anything I do say upsets you in any way, please stop the video. Please call 988, call 911 if you find yourself that you need immediate assistance. Some of the topics discussed here may be sensitive to some folks, and I respect that. So please just take care of yourself and get the help that you may need. Estimated 703,000 suicides in the world, and roughly 46,000 deaths by suicide in the United States, based on the 2020 statistics. Uh, American Foundation for Suicide Prevention has a lot of statistics and information. It's a great resource, easy website to search for. So some potential risk factors or warning signs. If you see someone that they're having changes or shifts in their behaviors, to some degree, unfortunately, this could be presented as someone feeling relieved or feeling better because they've actually made a decision to die by suicide. So if there's been a drastic shift, that would be something to be concerned about. Um, Other emotions, agitation, humiliation, and shame, things of that nature, be on the lookout for that as well. If someone starts talking about or mentioning different topics or areas related to suicide, for example, feeling hopeless, if they feel like they're burdened, feel trapped, physical, emotional pain that's unbearable, if they talk about not having a reason to live, if you see that there's more isolation and withdrawing from activities, or there's an increase in substance use, those can all be potential risk factors or warning signs. If they kind of start saying goodbye, like, hey, if I don't see you again, well, since I'm not going to see you again, or look, it's been great knowing you, things like that, that might be a warning sign. Giving away prized possessions, things that they cherish and love. And you're like, hey, why are you giving me this? This is so important to you. That could be a potential warning sign or risk, right? Other risk, the anniversary of a loss, any past attempts, or someone stops going to counseling or seeing a mental health professional, stopping taking any kind of medications, those can all be potential risk factors to consider. Some potential protective factors is, of course, access and use of mental health care, feeling connected to family, friends, and community, feeling supported from others, and having a strong religious or cultural belief structure that supports seeking behavior. Those can all be protective factors. We do want to encourage everybody that if you're struggling, reach out for help. Go talk to somebody, whether that be a clergy member, a pastor, a friend, a family member, somebody. Just please talk to somebody. And in particular, one of the best things to do is eventually get to a mental health provider, someone who's going to be able to provide a level of clinical services that will hopefully help. Some myths related to suicide, talking about or asking someone if they're thinking about suicide will put the idea in their head. That is not true. All of the research supports that. If someone is going to think about that, they've already thought about it, and asking them about it, it's not, they're not going to go, oh, I haven't thought about suicide. Maybe that's not going to happen. That's not how it works. Additional myth, people who talk about suicide are seeking attention. That's not true. And sometimes, unfortunately, when someone mentions that, if someone has this attitude that it is about attention seeking, then unfortunately they may discount or minimize the struggles that that individual is having. Additional myths: suicide always occur without a warning. We There's often signs, folks, and we just encourage you to be on the lookout, and to consider that this is a possibility for anybody. And don't be afraid to ask, right? And the last one myth is that suicide can't be prevented. It can be prevented. It can definitely be prevented, and that's one of the reasons why I wanted to do this video is to provide some education, and hopefully this video series will help. So part two, we'll explore some concepts regarding other risks factors related to suicide and some things that we may be able to do to help reduce the risk of suicide. Remember, if you see any concerning risk factors, right, ask them if they're thinking of suicide. And when you ask them, be direct. Are you thinking about killing yourself? Are you thinking about dying by suicide? Are you thinking about suicide? Uh, Avoid saying something like, "You're not thinking about killing yourself, are you?" Because when you say it that way, it comes across judgmental, and they may go, "No, of course I'm not," right? So please, if you're gonna ask, just ask direct without any judgment, and simply ask, "Are you thinking about killing yourself? Are you thinking about dying by suicide?" Thank you for watching and listening. Until next time, you stay safe and be sure